Hello, my curious cats, and welcome back to another episode of the Say Psychology Podcast, the podcast for all the info on psychology's most questionable history. I'm your host, Leslie Lopez, PhD student and psychology nerd. Okay, is it like just me, but like I am just so beyond tired lately, and I don't know what it is. I know like everyone's always so tired. If it's not one thing, it's another. That's for sure. If our parents ever got one thing right, it's that quote. If it's not one thing, it's another. Okay. I don't know if I know I just started a new position at work, which I am so happy about, but like it's a lot of stress, right? And then also just like the state of the world we live in. We just went through a terrible election, which that could take a strain on a lot of us. Also, just global warming, the economy, CEOs getting out of nowhere. Just, sometimes you just need a break. And by break, I mean like infinite hours of sleep, right? No suicidal shit or anything like that, but do you guys know what I mean? Also, my sleep schedule is like non-existent, but I'm pretty sure that has something to do with it, right? Who needs a sleep schedule anyways, right? But anyways, like I said, no suicidal shit or anything like that, but sometimes I just wish I could go into like a really deep slumber and just not wake up for days on end, right? You guys know what I'm talking about? Well, fun fact, you used to be able to do that. Except you wouldn't wake up at your own discretion, but rather the doctor's discretion. So, going into today's episode, today we're learning about deep sleep therapy, a psychiatric treatment where drugs were used to keep patients unconscious for a very long period of time to treat certain mental disorders. So, if you're a little bit insane in the membrane like me, get cozy tozy and let's jump into it. Now, before we dive into the history of deep sleep therapy, let's learn a little bit about what exactly is deep sleep therapy, because that sounds like something that I would gladly sign up for free. But like, let's not do that, okay? Because deep sleep therapy is a discredited form of psychiatric treatment in which drugs are used to keep mentally ill patients unconscious for a very long period of time. I'm talking from days to even weeks at a time sometimes. The name itself sounds nice, right? Deep sleep therapy sounds like you would just take a few extra gummies and you're all cured the next morning. Bye-bye, mental illness. That would be so nice. Well, not quite, because the term deep sleep indicates a natural state where the body is like, oh no, I'm tired, time to get some shut-eye. And then you just like naturally wake up when the brain and the body are like, okay, I feel refreshed, time to get up. But deep sleep therapy is not like that, because the procedure was not natural, okay? Like the patient was forced to sleep under a cocktail of drugs, and then the doctor was the one who decided when it was time to wake up. Also, I'm no sleep expert, but I'm pretty sure it's not a normal or natural sleep cycle when the person is asleep for days or even weeks at a time, right? Like, do you guys see what I'm saying? So now I feel like we have a good understanding of what deep sleep therapy is or was. So like there's a lot that goes into it, but like to understand what it is, like it's pretty straightforward, right? Like you just sleep for a long period of time because you're under drugs. Sounds nice again, but it's not. Right, so the use of sleep for psychiatric purposes was first introduced by Scottish psychiatrist Neil MacLeod in the very early 1900s. Essentially, he used a chemical by the name of sodium bromide to induce sleep in some of his psychiatric patients. He quickly gave up on the method when one of his patients died. Smart move on his part, honestly. I wish we could still think that way. In 1915, an Italian psychiatrist by the name of Giuseppe Epifanio, I butchered that, I am so sorry, I just know I did. He tried his hand at barbiturate-induced sleep therapy at another psychiatric clinic in Italy. Barbiturates are like a cocktail of drugs that slow down the central nervous system and cause the patient to fall into a deep sleep. Remember that, okay? You're going to need that information a little later. Well, he started off strong with this little hypothesis of his, but it ultimately gave him null results, N-U-L-L, meaning he had little to no results, positive or negative. So he ditched it. Also, oh my god, side note, my hair is getting so frizzy. I just showered and I just straightened my hair like But like, oh my God, it's really hot in here, you guys, but I can't open the window because it's just as humid out, and also like the sound of the outside is just gonna like interrupt the podcast. But it's humid in here. Wow, that's something about Texas I was not prepared for. And my hair does not do well in humidity, clearly. Okay, back to history. It wasn't until the 1920s that deep sleep therapy began to be popularized by Swiss psychiatrist Jacob Claessy. Claessy. Not Kalisi. Claessy. He took every previous failed attempt at curing mental illness, meshed them all together, and created his own method. His method including using a combination of two barbiturates that together are known today as somnifen. Now, what made Claessy's method unique from his predecessors was that while the patient was in this comatose state, he used ECT to target certain brain neurons to ensure schizophrenia treatment. If you remember from many of our past episodes, this time in history is very well known for using electricity on the brain to treat mental illness, but also like specifically schizophrenia. I mean, I don't know. We've just always had this fascination with schizophrenia in the medical field. Insane. Well, that and homosexuality, but that's for a totally different conversation. But Claessy's method quickly gained traction through the US and UK through the 1930s and 1940s. So we've seen so far that the history isn't exactly the best. We have some questionable methods and a dead patient so far. Surely, that should be more than enough to pause and reconsider the therapy and its methods, you would think. Well, as we've learned, the history of psychology is anything but. For the main bulk of today's episode, let's travel down to the island, the country, the continent of Australia. Australia, home of kangaroos and giant spiders. So I've heard. Listen, I mean this in the kindest way possible, okay? But Australia is just one of those places that I will absolutely never travel to. I'm not saying never say never, of course, but like never desire to travel to, I would say fits better. It's just like, you know, like I'm sure it is absolutely beautiful and amazingly filled with experiences, but also the bugs, the giant spiders, I can't. I'm sorry. I just can't. I'm sorry. But anyways, we are in Australia for today's episode. And with that, our main character today is Dr. Harry Bailey, a 28-year-old psychiatrist who from a very young age was fascinated by the study and the treatment of mental illness. Kind of like me. He started his career in the early 1950s in one of Australia's oldest and better known psychiatric hospitals. Look at him go. As I mentioned, Dr. Harry Bailey's his interests was in the treatment of mental illness, okay? Well, this was early in the 1950s and the treatment was still wildly new in the field of medicine. It depends from whose point of view you see it. It was either a good or a bad thing. For the patients, this was obviously not such a good thing. I mean, when you're sick, the last thing you want is for doctors to guess what is wrong with you and just try and guess how to fix it. Although that does kind of sound like today. But for doctors in the 1950s, like Bailey, this was the opportunity of a lifetime because many doctors like himself were willing to try anything, and I mean anything, to find a solution. At the time, a previous very famous but also now debunked technique was insulin coma therapy. Remember that one? If you haven't checked out that episode, I highly suggest you do because it is very informative and kind of a preface to today's episode. But anyways, when doctors soon realized that putting patients into comas was a little too dangerous, given the risk that some of them may not wake up and some of them didn't wake up, many decided that maybe the risk did not outweigh the potential benefits. And if you remember from our episode, the treatment had virtually no benefits anyways. But then we have doctors like Harry Bailey who saw insulin coma therapy, and instead of saying, no, the risk of having so many patients die of coma is not worth it, he said, how can we make the coma therapy a lot more effective? Wow. We all know someone like that, right? We all do. I roll. Part of the issue lied in the fact that at the time it was still widely believed that mental disorders were due to a physical abnormality in the patient. not exactly a mental one. So many doctors did still believe that a coma could, in a way, restart the body into a healthy state, that they just needed an effective coma treatment to do so. Dr. Harry Bailey truly believed that with the right coma technique, he could cure some of the greatest mental illnesses out there, such as, say it with me, schizophrenia. That's right. Everyone's favorite. One of Bailey's techniques included believing that the longer a forcefully induced coma, the better. And this idea led to his methodology and procedure, which included using a long-lasting substance, which was really just a cocktail of different sedatives that, when used all at once in one big dose, would cause the initial coma. Then, as the patient slept over time, they would be injected with intermittent smaller doses to keep them comatose for that long period of time. See, the logic is there. Like, it's just that at this point, we already have a history of why this isn't a good idea. And it's his insistence that is a big part of the issue to do. Like, do you see what I mean? So, because Bailey wasn't exactly a registered doctor at the time, he was more like an intern. He had just recently graduated and was getting his hours or something like that. He didn't have his own patients. So, experimenting was kind of difficult because he was at a public hospital. So, the government kept constant tabs on its patients, and he couldn't just have his own in that case. And if there's one lesson I've learned in my 28 years of being alive, it's the importance of networking and the effect it can have on your success, okay? I cannot stress this enough, but networking has the power to get you into places that no degree and no job ever will. Well, that and not wearing a bra, but back to Bailey. Okay, so Bailey, even though he was only 2 years into his internship, and I don't know how long it was supposed to last, but certainly more than 2 years, through networking with the right people, he was able to attain a position of authority at the public hospital. I'm telling you. More specifically, he was appointed the role of Assistant Clinical Director of the Division of Mental Health Hygiene of the New South Wales Department of Health. That is a mouthful. And a workload, especially for someone who was still of student status like Bailey was. Essentially, he would oversee clinical treatment protocols, organize important conferences, and review a wide array of new initiatives for various hospitals across the state of New South Wales. If he wasn't so ill-intent, I would snap my fingers and congratulate him, but I won't, and we'll see why. But either way, in 1954, at 31, he officially graduated with high honors, high awards, recognition, yada yada. I mean, Bailey, he was a smart cookie, okay? Don't get me wrong. He still had to finish his training and take a lot of fancy tests. He wasn't just going to get out of it so easily. Probably his most valuable lesson of all his training was how to properly network with the right people, but he still had to go through the motions, right? Soon after he graduated, he found himself rubbing shoulders with Dr. Ian Fraser, the Chief Medical Officer of Mental Health in New South Wales. Now, officially, Dr. Harry Bailey, he promised Fraser that he could bring widespread innovation to the field of mental health all over the world, starting in Australia. Fraser thought that sounded nice, and he said, sure, what the hell. Through the power of networking, Dr. Bailey sent a research proposal to the World Health Organization detailing his ideas, his methods, his goals, etc. And they accepted it. I'm telling you, the guy has game. He became Australia's first traveling research scholar. Seriously. At the time, he was married, which was nice because his wife rode along on a bunch of research excavations all over the world in the name of science, funded by the WHO. Good for her. While he was traveling, his literature findings included watching and meeting doctors who relied on electroshock therapy, others who used LSD, all in the name of mental health. Dr. Bailey took all his literature findings back home to New South Wales and officially got to work in 1956. So remember, Dr. Bailey had already witnessed the history of insulin coma therapy, and he was now witnessing the decline of ECT. However, he held on to his belief that the longer the sedation, the more effective it would be in treating mental health disorders. Dr. Bailey was the talk of the town at this point, okay? He and his buddy, Dr. Ian Fraser, were able to pull some strings and get him his own department at the hospital where he would be able to conduct his own experiments. I mean, he was either so smooth or they were just so desperate. Maybe a little bit of both, honestly. Dr. Bailey quickly began working his way to the tippy top of the hospital, claiming that his unit was the most important unit in the whole hospital. Why? Because according to Harry Bailey, schizophrenia was the most dangerous condition in the whole world. According to Bailey, 2 in every 3 children were suffering from schizophrenia on the daily. First of all, he made it sound like schizophrenia was an airborne disease. Wrong. Second of all, for a doctor, I have no idea where he was getting these stats from, because even today, we know that only less than 1% of the world population suffer from schizophrenia. So, make it make sense, Dr. Harry Bailey. So about 3 years into his new unit at his old hospital, it was quickly noted that there was little to no innovation coming from it. On average, they were performing about 1 operation a year. This isn't funny, but it brings me a little bit of joy to see him suffer. Anyways, but to the hospital, this wasn't funny, okay? Either because they poured so much money into his work for nothing, eventually everyone turned on him, even his buddy Fraser. Oh, fuck fake friends, am I right? Bailey, on the other hand, wasn't going to let this stop him from finding a cure for schizophrenia, however. After he was fired, he found himself in private practice where the only deadline and expectations would be his own. Before he knew it, Dr. Bailey found himself at the Chelmsford Private Hospital in Sydney, Australia. A small 15-bed cottage that was more than he needed to begin his private practice. Dr. Bailey was officially the chief psychiatrist and director of the deep sleep therapy ward. He was more than eager to put his own spin of coma therapy into practice. During his treatment, patients were heavily sedated for long periods of time with the intention of resetting their brains, like I mentioned earlier. Of course, some patients were a bit skeptical, as they should be, but Bailey explained to them that they would have nothing to worry about, okay? They should just view it as a very long nap. Just as a good sleep session enables the body to wake up feeling refreshed, so will it enable the brain to wake up refreshed. Man, I won't lie to you, this probably would have worked on me back then. And I'm not even kidding. One of his most famous patients was actually his first patient, a young 17-year-old girl whose father forced her to go under treatment because she suffered too many premenstrual mood swings. Now, as someone with PMDD, I just know that I would have been fried at the first chance. And it's not funny, but I'm laughing because I already laugh at myself way too much to not whenever the opportunity permits, okay? This poor girl, and okay, not only does she have really bad PMS, but she's 17, so she also has all these teenage hormones on top of all that. Y'all remember those? Man, my dad would have probably done the same thing given the chance, and I have no doubt. But back to Bailey. His patients were notoriously held in a drug-induced coma for what he called a holiday for the brain. During these holidays, patients were administered electroshock therapy as well. Yes, while in a coma, Bailey used electroshock therapy on patients. As if that wasn't bad enough, he believed that if the patient was already comatose, they didn't need the anesthetic. But insurance companies didn't need to know that. So he still charged the use of anesthetics without using them. Awesome, just peachy, right? These treatments, of course, came with their own complications. Often upon waking up, patients were lethargic and fell into a deep depression, soon after which was treated with, you guessed it, more deep sleep therapy. Other complications included bladder issues and infections, all of which went untreated. They kind of just brushed it off, thinking it was just the side effect of the miraculous healing that was happening. While unconscious, it was more than common for the patients to sit in their own waste and urine for several hours. As a result, the entire deep sleep therapy ward reeked of waste and urine. But honestly, the smell of the ward and the state of the patients weren't the worst of it when you consider the risks of low blood oxygen and overdose that were on the table. The condition of low blood oxygen levels to the brain is called cyanosis, which can be fatal if not treated immediately and properly. This was quite common in Dr. Bailey's deep sleep therapy ward. Not just the cyanosis, but the death by cyanosis. In other cases, there are a number of patients who died in their coma after being sedated too heavily. Even though the point of the coma was to last days, they just never woke up after the intended number of days had passed. So, an overdose. And overdose was just something that was also common and not treated for at Dr. Bailey's deep sleep therapy ward. Where are the families and loved ones of these patients is my question, really. Like, yes, I partly get the desperation of wanting their loved ones to get better, but what baffles me is that many of his patients weren't even schizophrenic, his target demographic, if you will. Many of his patients were just hysteric. And by hysteric, I mean women with PMS, women with menopause, patients with PTSD, patients with autism, etc. And the fact that this was all happening in the 1960s, we've come such a long way in so little time. Thank God. His work continued all the way through the 1960s and well into the 1970s. Dr. Bailey was forced to officially resign in 1979 after he fell into a deep depression that was the result of some of his most insane life situations that included medical malpractice and sleeping with his patients. I'm not going to go into too much detail because next season will be all about history's most dangerous psychologists and psychiatrists, and there's a whole separate episode on Dr. Bailey's whole life story, so keep an eye out for that, okay? But for now, since it is an essential pinpoint to today's episode of Deep Sleep Therapy, know that his work marked a serious issue in the mental health system. It's reported that 25 patients died just under his deep sleep therapy treatment. However, it's suspected that it was much higher since he was known to embellish medical reports for insurance purposes, including the state of the patient's health. The treatment of deep sleep therapy died when Bailey was no longer welcomed in the medical world in 1979. Deep sleep therapy never actually made it out of Sydney, Australia, thank goodness. That wasn't Bailey's initial intention, if you guys remember. His dream was to be known as this world-renowned doctor who invented the one treatment that would cure all mental disorders. But sadly for him, that didn't happen. But good for us, that didn't happen. Well, my curious cats, thank you so much for tuning into today's episode. I really hope you guys learned something new and that it also kept you on your toes for more. If you guys enjoyed this episode, please remember to like, subscribe, and follow the podcast on YouTube, Spotify, and Apple Podcasts. And also check it out on Instagram at the Say Psychology Podcast for all episode news and updates. As always, citations will be in the description if you want to check those out. Stay blessed, stay sane, and stay psyched. I love you. Bye.